Mayor, it's 7:30, and so I turn the town hall over to you for the introductions.
All right, thank you very much. Good evening. I am David Tarter, the mayor of the city of Falls Church, Virginia. Welcome to our virtual town hall on the coronavirus pandemic. Falls Church, like the rest of the nation and the world, is in the midst of fighting this unprecedented catastrophe. But please know that your local government is working relentlessly to keep you safe. Tonight's virtual meeting is part of our effort to keep the community healthy and informed every step of the way. I'm joined by my colleague, Greg Anderson, chair of our school board, who will speak in just a moment. Later, our superintendent of schools, Peter Noonan, and city manager Wyatt Shields will brief us on operational changes the city and schools are making to keep the public and our employees safe. The city is a member of the Fairfax Health District, and we will be joined by Colin Brody from the department's Division of Emergency Management. Mr. Brody will provide a briefing on the coronavirus, how it spreads, its symptoms, and our public health response. Finally, we'll be joined by Delegate Marcus Simon, who will discuss the state's efforts. Tonight's virtual town hall is live streamed and also broadcast on our local public access TV. A tape of tonight's town hall will also be available on the city's website at www.fallschurchva.gov. We'll also be taking questions during this town hall. Please send them to townhall@fallschurchva.gov. We'll respond to them at the end of the briefings. Similar questions will be grouped together as one. We look forward to hearing from you. In the coming days, we'll likely rely more and more on digital public outreach to continue important city business and to engage with citizens in the most transparent and safe manner. Our city, like communities across the country and the world, is reeling from the disruptions caused by the coronavirus and the necessary responses to it. Our school, library, community center, and playgrounds are all closed, and most of us have been told not to go to work. City restaurants and other small businesses have closed or have greatly reduced their operations for the common good. They will suffer great financial losses. When this crisis has abated, we must come together for their good. It's a disruption to life and livelihood that we have never seen before. Mr. Brody will explain the public health reasons for these strong measures. The city has been tracking the coronavirus since late 2019, at which time we planned our response to its inevitable arrival here. From the beginning, we committed to following the guidance of federal, state, and local public health officials. We have done so. Being decisive in favor of protecting residents and employees' health. We have done so. Advocating for our residents and businesses to ensure that there is federal and state assistance to mitigate economic losses, which are significant and growing. We are now and will continue to do so. And finally, to communicate. People need reliable information during any emergency, and that is particularly true now. Ignore rumors and rely on trusted information sources, such as the websites for the city, the Fairfax Health Department, the Virginia Department of Health, and the Centers for Disease Control. Falls Church is providing daily briefings on the coronavirus for our community. If you have not yet subscribed, please do so on the city website shown below. Chair Anderson and Superintendent Noonan have and will continue to send regular updates to the school community on their strong response to protecting students, teachers, and staff while continuing to educate. My colleagues on council and I are regularly communicating with our federal, state, and regional partners. I'm the chair of the Northern Virginia Regional Commission. As such, I'm in constant contact with the region's elected officials and top management. We in Northern Virginia are working together to rapidly share information and coordinate our response efforts. City staff are likewise connected with their governmental peers to devise and apply best practices during this unprecedented event. As you know, Falls Church had its first confirmed cases this past week when 2 seniors at the Kensington Assisted Living Facility tested positive. Since then, the number of cases around the region has continued to grow, and it is now assumed that the virus is being transmitted by community spread. This truly brings the problem home for all of us and underscores the importance of following the guidelines of our health experts. To say this as plainly as possible, less of our friends, less of our neighbors, less of our family members, and less of us will get sick or die if we follow the best advice of our medical professionals. Our behavior will make all the difference. I am confident that by following the guidance of our health experts, by being decisive and firm in our response, by advocating for our community, and by communicating what we are doing and why, we will get through this emergency, recover, and emerge stronger than ever. With that, I'll turn it over to Greg Anderson, Chair of the School Board. Mr. Anderson?
Thank you, Mayor Tarter, and good evening, everyone. I'm Greg Anderson. I'm the Chair of the Falls Church City School Board. And I'd like to start by giving you just some brief information about the school's response before Dr. Noonan gives you some more details. And I'd just like to start by saying our schools in our city clearly are facing unprecedented challenges, and we face them together. We've been working in close coordination with the City Council, the City Manager, City staff, our partners in navigating all of these uncertain times. And we're very thankful for their partnership and grateful for their ongoing communication with us. As you're probably aware, Governor Northam today ordered the closure of all Virginia K-12 schools for the rest of the school year. And no doubt you have lots of questions about what all this means. So do we. Dr. Noonan, the school board, and all the Falls Church City Public Schools team are working on those answers, and we'll get them to you as quickly as we can, but we need to ask for your patience as we do so. Even before today's announcement, our school buildings and our grounds were closed, but thanks to the careful planning and the hard work of Dr. Noonan and the whole SCCPS team, our schools are open and teaching in new ways. The methods have changed, but the mission hasn't. As before, everyone at FCCPS is dedicated to ensuring we provide the best quality education we can for all our students. And I want to say thank you to Dr. Noonan and his team for their leadership and their caring, and thanks to everyone as we adapt to all of these new methods. We are a caring community, and with our partners at the Falls Church Education Foundation and the PTAs and PTSA, we're supporting our most vulnerable families with additional resources to meet their needs at this difficult time. And finally, thanks to everyone in the community who's come forward with constructive ideas and suggestions, ways that we can make this work better, ways we can make this work more easily. And we really appreciate your input. This is a challenging and uncertain time, but I'm confident that we can work together to get through this because we are better together. And along those themes now, I'd like to introduce the Superintendent of Schools, Dr. Peter Noonan, for some further details.
Thank you, Chairman Anderson. Good evening, everyone. Mayor Tarter. It is an unfortunate evening to have to meet like this, to say the least, but I want to say thank you to all of you and to the community for your incredible support of our schools. Today was a rather dramatic shift from where we were even a week ago with respect to the schools. And as I thought about my comments tonight, I've sorted them into three buckets, if you will. The first is around instruction. The second one is around operations, and the third one is really about community. And I want to start with instruction. And I recognize that this is going to be a challenge. And I want to just say that up front, and I know that it's going to be a challenge for us. It's going to be a challenge for our families. But we are committed to supporting the community and supporting our students to make sure that there is continuity of instruction happening throughout the remainder of the year. To this point, about 25 days ago, we had an opportunity to meet as a leadership team and begin planning for what we thought might be the inevitable. And so as a consequence of that, we have moved to our online instructional programming as of last Thursday. The feedback that we've received so far has been rather overwhelmingly positive. We've heard some great stories about teachers making connections with their kids, kids making connections with each other, and really engaging in different ways. We are a very fortunate community to have one-to-one computing opportunities for every single kid in our community, as well as Wi-Fi in every home that has been provided for those families that haven't been able to afford it. So it gives us a good foundation to start from with respect to that continuity of instruction. One of the things that I want to be very clear about with respect to that continuity of instruction is that between now and spring break, we will continue with our instructional programming as it is and as it has been for the last 3 days. We have lesson plans that have been developed by our teachers to support that learning, and that will carry us actually past spring break. So between now and spring break, which we will recognize on April 6th, Monday, through April 10th, for the 10th, on that Friday, that will be days off for students. But the expectation is between now and then, our students will continue with their continuity of instruction through that online platform with the lessons that have been put in. One thing I want to make also clear is that we are committed to serving all of the students in our community. We have ESOL students, we have special education students, we have students that are on 504 plans, we have advanced academic learners and the like. And so right now, what we are working on is figuring out ways for us to adequately meet the needs of all of the students of our community. Because we are out by governor's order, and because the material that we are working through is considered continuity of learning and continuity of instruction, no new material is going to be touched on between now and spring break. But after spring break, when we begin to look at new instruction, we will be engaging differently with our special education, ESOL students, and the like. One thing I can say is that our Director of Special Services, Rebecca Sharp, who's been extraordinary through this process, and our Chief Academic Officer, William Bates, and their teams will be reaching out to every single parent of a student who has an IEP over the course of the next week. It's one of the beauties of us being small is we know our families. Some of the questions with respect to instruction that have come up, just to kind of share with you briefly, we are actively as a Commonwealth of Virginia seeking waivers from the federal government to waive certain accountability and accreditation pieces. We understand from the U.S. Department of Education that those waivers at this point are going to be granted. So there will not be any SOL testing this year. We are waiting for further guidance from the Virginia Department of Education around credit awarding, graduation, how our seniors will graduate, and recommendations with respect to that. We expect that guidance within the next 24 hours. We also have gotten some clarification from the International Baccalaureate Program. And International Baccalaureate Program has indicated that they are not going to administer any exams this year for students who are taking IB courses. Additionally, we learned just this afternoon that advanced placement, and we do offer some AP courses, will be modifying their assessment process. And instead of doing the 3-hour assessments, we'll be doing 45-minute assessments online, and those can be done from home, but there's more to come about that. Also in the instructional realm, in terms of activities, athletics, and the like, all of those are unfortunately canceled for the remainder of this year. When it comes to operations, there are some things I want to just talk about very briefly. The first is that right now, our support staff are working diligently to clean our buildings from tip to tail, as well as our buses have all now been cleaned and sanitized. So when it is time for us to come back in the fall, we'll have some really beautiful sites and some really clean buildings, and we'll be ready to go. Additionally, as Chair Anderson indicated, our fields and our playgrounds continue to be closed. It will be imperative that people do not congregate on those sites. And then lastly, with respect to operations, we've gotten a lot of questions about our employees and how we're treating our employees going forward. And I want to be really clear to say that those employees for us that are on contract will continue to be paid for their contract work, because we will be continuing to teach and continuing to work. And then the hourly employees that we have in our system who are particularly vulnerable will also be paid during this time of closure. We really believe that it's important to take care of our hourly employees. And so as a consequence of that, we are looking at the average pay of last month, and those employees will continue to get their average pay if they are hourly employees going forward. The last sort of big bucket that I wanted to touch on quickly, and Mr. Anderson sort of spoke about it a little bit, and that is the partnerships that we have with the Ed Foundation and the PTAs, and how we're supporting through food and other resources some of our most vulnerable communities in the City of Falls Church. And through the really great work of the Ed Foundation and our PTAs and others, we were able to, before the closures, hand out to 230 families food boxes that had enough food in them for 2 weeks, as well as a $50 gift card for groceries. We have, through the generosity of our community, been able to build another stockpile of money to be able to go out and recharge some of those gift cards for our families, and are looking forward to that. Operationally or community-wide also, I've gotten some questions about the high school project, and I want to just let everybody know that at this point we are not clear of any impacts that will come to the timeline with the new high school. However, I think it's fair to assume, based on state closures like New York closing, Pennsylvania closing, Maryland closing, where we are sourcing some of our materials for the new high school, that there is it's not unreasonable to assume that there will be some sort of slowdown in that project. We are planning to continue the learning after spring break, making sure that we have that good continuity of service. We may consider doing some intersession during the summer for students who may need some extra time and support for learning, and then we will start next year as planned. We know that all of this is going to take some resource, particularly money, and we are really excited that Delegate Simon's on the call tonight, because I know that he and his colleagues in Richmond are working on some supplemental funding packages that will be helpful not only at the state level, but there's also at the national level, federal level, looking at some supplements as well. And then lastly, around communication, I just want to make sure that everybody knows that we have all of our COVID-19 plans on our website. I will continue, as I have, communicating with the community every Tuesday and every Friday, or as needed, like we did today. And I do hope that as time passes, you will settle into the routines and know that while this is an imperfect solution, we are working as diligently as we can to make sure that it's the best for you, best for your kids, and best for our community working forward. So thank you all very much for your incredible support. And I'm saying that to the community in particular. And I will now turn it over to my colleague and friend, Mr. Wyatt Shields, our city manager, for his update. Thank you.
Well, thank you, Dr. Noonan, and thank you for that report. I'll report on city operations, and I'll just say by way of introduction that in this public health emergency, this will be a long duration event. A lot of the measures that we're putting into place really are there to protect the public during the period before there is a vaccine or other protection against this virus. There are really three main toolkits that we all have at our disposal to fight this virus, and that is the individual toolkit, which involves washing hands, covering our coughs. If sick, stay home. Mr. Brody will describe these in more detail. The community toolkit, which is what I'll talk most about, is the need for social distancing, limiting public gatherings where human-to-human transmission can occur, and shutting down places where gatherings would naturally occur to reduce the opportunity for spread. And then the third big toolkit is the environmental toolkit, which involves cleaning our public spaces, particularly high-touch areas, again, to try to suppress the transmission of this disease. So with respect to the community toolkit, following the policies of the health department and working with federal and state authorities, here's what we've done and are doing. We have closed the library and the community center. We've canceled all of our programs and classes. Our playground equipment is closed also. Those were natural gathering places, and we felt that they could not be kept safe. We weren't able to keep those disinfected. The farmers market was suspended this past week, and we're looking at the guidance from the governor and the health authorities on determining its status going forward. City Hall is closed to the general public, with currently 3 offices receiving public visitors, and those are the city building permits counter, the treasurer's counter, and the commissioner of revenue's counter. We're keeping those open so long as the level of visitation to these offices remains light. And so far, it's our observation that we've been able to keep those offices open because generally there's only been 1 or 2 people coming at a time. If they get more crowded, then we may have to do a move to by appointment only, but that's not needed at the present time. All other city staff that can work from home are working from home. City business is being done, but it's being done remotely from home. I want to thank our ITS, our information technology staff, for their hard work in supporting all of city staff in making this transition to home work. For the public, most city services can be accessed online. If you go to the city's website at www.fallschurchva.gov, right there on the left-hand banner, you will see ways to be able to conduct most business online. Our essential personnel are operating. DPW, our Department of Public Works operations, are working here in the city to manage critical government services, their sanitary sewer maintenance operations, street maintenance, traffic signal maintenance. Our city dispatch offices are operational 24/7. We do ask that people only call 911 for police, fire, or medical emergencies. All other inquiries should go to 703-248-5200. Again, 703-248-5200. This number is being manned during business hours to answer any questions about services or about health information. We can provide referrals to Fairfax County Health through this number, but there will be someone there to pick up the line to help you. It's really important that we keep our dispatch office focused really just on police, fire, medical emergencies, and not routine matters. Police are responding to calls for service. If you do call for service with police, you should expect a new process, which is a questionnaire for residents of the home and possible symptoms or testing for coronavirus, which is outstanding. These questions are intended to provide our police officers with situational awareness before they enter a home in response to a call, and we ask for everyone's cooperation with that. Our police officers are equipped with personal protective equipment to help keep them safe and, of course, to help them keep the public safe. Our City of Office Communication is putting out a daily brief, as the mayor noted. We're putting this out generally at about 2 o'clock every day. That provides critical updates on closings or information from Fairfax County Health Department. The city's website is also being constantly updated with the latest information as well. You can sign up for that daily briefing or for Falls Church alerts, which can be done at, again, fallschurchva.gov/COVID-19. We'll take you straight to the page to be able to sign up for those briefings. We've also been placing a full-page ad in the news press to reach those that might not be on social media or have access to a computer to help get information out through that way. Our human services staff have also been going door to door, particularly to our vulnerable populations, to our senior living facilities, our homeless shelter, which is now closed, but reaching out to those to seniors who live at home, who participate in city senior programs, just to push information out, share information that will help people access services that they need and also to protect themselves. Also on the city webpage, we're maintaining a current list of volunteer organizations for opportunities for residents who want to help their neighbors. It will help them get in contact with organizations that are doing that service right now. For our city budget, we have basically hit a 30-day pause on our budget process to, one, determine our revenue picture, and two, to determine how best public meetings appropriate for the budget can be conducted in a manner that's safe for all. All of our city staff have responded so quickly with the urgency that this situation requires, and I want to send out my thanks to our dedicated staff and to the community for everyone's working together to make these changes. For our business community, and the mayor noted this in his comments, this is not a potential catastrophe. It is devastating right now. We're committed to advocating with you and for you for federal and state assistance. Cindy Mester is our staff lead to support our mayor and council in lobbying Richmond and Washington for public policy that will support our businesses and their employees and help them survive these closures. I've asked Kieran Bawa, our Chief Financial Officer, to lead a team with our Treasurer and Commissioner to work with the business community to figure out the right steps to help businesses with respect to tax payments and to bring those recommendations to City Council. Ideally, tax relief policy should be set statewide to avoid confusion in the business community amongst all the various jurisdictions. But failing state guidance on this, we will work to align what we're doing here with what's happening in Northern Virginia with respect to tax policy. The governor today, in his Executive Order 53, ordered restaurants, theaters, and other entertainment area businesses to close effectively midnight on Tuesday. Restaurants may remain open for takeout business only. It is an indication of the very strong social responsibility that's been displayed by our business community that all of our restaurants that I'm aware of had already closed or went to takeout only well in advance of the governor's order. I really thank our business community for that act of responsibility that came at great cost to them. For our school community, as a parent, I share the strong sense of displacement and disorientation and sadness that comes with the need to close our schools for the remainder of the year. The city government, general government, stands in solidarity with our school administration as they have with us throughout this crisis. The City of Falls Church is a member of the Fairfax County Health District. We are very fortunate to have one of the strongest local health departments in the country serving us during this pandemic. Dr. Gloria Ado-Ayensu and her staff have been working around the clock to guide us in our response. I now would like to turn it over to Mr. Colin Brody for his presentation and his briefing for the community. Mr. Brody, as the mayor noted, is with Fairfax County Health Department and their Department of Emergency Management. He has provided a briefing for the city staff, and I want to thank him and his colleagues for their service to the city and its residences and businesses. Mr. Brody.
We are working on getting Mr. Brody's presentation up. Please bear with us one moment. You are watching the City of Falls Church's town hall, virtual town hall, on the COVID-19 pandemic. We are still taking questions through our email address, which is townhall@fallschurchva.gov. Please feel free to email us questions there. We might not be able to get to every question tonight, but please go ahead and email us there. We will give you answers either tonight or this week. We will respond to you with answers and resources. While we're working on getting the presentation up, we would like to remind you that you can call Fairfax Health 703-267-3511 during certain times of day. You might see that on the screen right now. You can also email them at ffxcovid@fairfaxcounty.gov. They also have a wealth of information on their website, which is fairfaxcounty.gov/health. Again, please note that the City of Falls Church is serviced by the Fairfax County Health Department. We are in their health district, which also includes the towns within Fairfax County and the City of Fairfax. Our apologies for the technical delays. We are almost there. Thank you for sticking with us. Once again, that email address is townhall@fallschurchva.gov. And again, if we don't get to your question tonight, we will try to respond to your email this week with resources, information, and answer to your question. And we're almost there. Please bear with us. Thank you so much for sticking with us through live television and live stream. All right, Colin Brody from Fairfax County Health Department will be giving his presentation as soon as we have it up on our screen. Thank you so much for being here tonight, Mr. Brody. And after Mr. Brody's presentation, we will have another quick speaker or two, and then we will have our Q&A session of this town hall. Mr. Brody, thank you.
Thank you very much. So as a way of introduction, my name is Colin Brody. I am the Senior Emergency Planner at the Fairfax County Health Department, and I work within the Office of Emergency Preparedness and Response. And I'm presenting here tonight. I have some set slides, and then we will go into a Q&A to hopefully address as many concerns and questions as possible in the time allotted. My background is in EMS. I am a paramedic by training, and I work in public health now. I also serve on one of the U.S. Department of Health and Human Services incident management teams, and I spent the early part of February at one of the federal quarantine facilities for returning cruise ship travelers. So COVID is something that has been with us for a long time, and we will get into that here in a moment. So I will begin with a bit of a warning, if the slides will advance, that this information changes on a daily basis. It changes hourly, it changes minute by minute. So the information that's presented tonight is everything that we knew as of about 6 p.m. tonight. Things may change during the presentation, and they may come up in the Q&A, and they may be news to me. But this is everything that we knew as of 6. This is the outline of what we will cover. We'll talk about the disease in general. We'll talk about the situation both internationally and here in the United States. We will talk about the county's response. And I will note, again, as Susan mentioned, that we are your health department. So although the slides say Fairfax County and I'm employed by the Fairfax County Health Department, we are the health department for the cities and towns within Fairfax County. So all of this applies equally to cities, towns, and the county at large. We will talk about some planning and preparedness, and then we will delve into some resources that are available online to support you. Next slide, please. Okay, so a quick note. We often get asked what we think will happen or what will happen in the future. And for public health, that's a difficult question. With diseases that we are used to and we see all the time, like influenza and norovirus and others, we can predict relatively well how that will spread through a population and what that means for us in the Fairfax Health District. Unfortunately, for this virus, we don't have that ability. So we cannot make high confidence predictions about many parts of this virus. And so we will focus tonight on what facts we have and what evidence has been presented, not just here in the United States, but globally. So a bit on coronaviruses. Coronaviruses circulate around the globe. They are the cause of common cold symptoms. At some point in our lives, we have likely all had a coronavirus infection. Sometimes new coronaviruses emerge from animal reservoirs, and they cause severe disease in humans. We saw this in 2002 with SARS, and we saw it in 2012 with MERS, and we are seeing it again now in 2020 with the novel coronavirus that's circulating. Coronaviruses are spread through coughing, sneezing, or close personal contact, and typically symptoms start 2 to 14 days after exposure. The median is about 5 days. This virus was first recognized in China among infected individuals who had all traveled to a wild animal market in Wuhan, China, and that city is located in Hubei province. The current research suggests that the virus likely came from bats, although there is an intermediate animal host that has been proposed but not proven. So that is something that is still being worked through on the research side. COVID is an acronym. It stands for Coronavirus Disease, which first emerged in 2019. That is why the end of it is a 19, although we do recognize that we are now into 2020. Going back, the first confirmed case was in China on December 8th, and it spread through first Wuhan, China, then it was widely scattered across most of China, then it was exported from China to other countries. The first United States domestic case was diagnosed on January 21st. We had our first case of what is called community transmission in February of 2020, February 26th, and then we had our first case in the Fairfax Health District on March 7th. And as I mentioned before, the Fairfax Health District is inclusive of not only the county, but also the cities and towns. Looking at numbers, again, these numbers change daily, and they are pretty staggering when you look at them on a global scale. There are over 290,000 cases across the world with about 12,700 deaths. 81,000 of the cases are in China, 33,000 are in the United States, 254 are in Virginia, and 43 are in the Fairfax Health District. And unfortunately, over the weekend, we did have our first death of one of our coronavirus patients here in the Fairfax Health District. This is a heat map showing distribution of cases globally. You can see the red dots. They are presented as a scale of number of confirmed cases. As lab testing grows across the world, these circles will continue to increase, and the World Health Organization publishes daily reports of case counts from around the world. Currently, there are Cdc travel notices in effect. For those not familiar with how Cdc publishes travel notices, there are varying levels of concern. Level 3 is towards the top, so you can see in pink and in orange on the slides, there is a recommendation to avoid all non-essential travel to all of the destinations listed there. And for the countries that are listed at the top, China, Iran, most European countries, the UK and Ireland, most foreign nationals who have been in one of those countries during the previous 14 days will not be allowed to enter the United States. That restriction does not exist for level 3 travel health notice countries. However, the recommendation to avoid all non-essential travel still exists. This is a map showing cases in the United States. You can see from the map that not all jurisdictions and not all states are affected equally at this point. Cases, the darker the state shows on the map, the more cases they have. Here in Virginia, we are somewhat in the middle of the pack. Disease spreads very differently based on the community makeup. In places that have a little more social distancing than New York City, for example, may have lower number of cases, whereas the highly dense urban populations may have more cases. And that's what we're seeing in New York City and a few other cities around the country. So in the United States as a whole, the immediate risk of being exposed is still low for most Americans, but as the outbreak expands, that risk will increase, and this is the case with any communicable disease. Cases of COVID-19 and instances of community spread are being reported in a growing number of states around the country. There is an elevated risk of exposure among certain populations within our community, people who live in places where there is ongoing community spread, healthcare workers who are caring for patients with coronavirus, close contacts of persons who are diagnosed and laboratory confirmed COVID cases, and travelers returning from affected international locations where we know community spread is occurring. We often get asked how this compares to past epidemics, and we in public health like to look at diseases that are very similar. So in this case, we look at past coronavirus epidemics. Again, those would be SARS and MERS. SARS originated in China in 2002, and you see what's called a case fatality rate on the screen. The case fatality rate is the number of deaths divided by the number of cases. What was concerning in MERS and SARS was the relatively high case fatality rate of 10 and 34%. So what that means is that if you take MERS, for example, 1 out of every 3 individuals who acquired MERS would die from their illness. We are not seeing that high of a case fatality rate with coronavirus. Despite the large number of infections around the world, the estimate of the case fatality rate is anywhere from 2 to 3%. So that means that of 100 people who get the virus, between 2 and 3 will ultimately die. Coronaviruses are spread mainly person to person. These viruses are spread by respiratory droplets that are produced when an individual who's infected with the virus coughs or sneezes. This typically is within about 6 feet. Human lungs, adult human lungs, typically can transmit droplets about 3 to 4 feet. So we use 6 feet as a buffer to make sure that if we are staying 6 feet apart, we are statistically very, very unlikely to be able to spread droplets from one to another. The other way it can spread, which is not the primary method, but it is one way, is contact with infected surfaces or objects. So this would be an example of someone who coughs into their hand and then immediately touches a doorknob, and the person behind them touches that doorknob and then touches their eye or their nose or their mouth, may get the virus that way. But again, this is not the main way the virus spreads. Symptoms of COVID across the world have resembled what is on the screen. So the most common symptoms have been a fever, a dry cough, and shortness of breath. Some patients have reported some other symptoms, fatigue, muscle aches, loss of appetite, sore throat, nausea, and diarrhea. Again, the course of any illness is different based on the patient and their medical history. But in general, we look for the 3 main, fever, cough, and shortness of breath, as an indication that an individual may have coronavirus. We also have a number of questions that come in every day about testing for coronavirus. So we'll talk a minute about how testing actually occurs. The tests that exist right now are looking for a specific viral RNA from what are called nasopharyngeal swabs. So there's a picture there of how this process actually works. And this swab, if you've had one done, is incredibly invasive and does not feel very good at all. It feels like your doctor or nurse is sticking a very long Q-tip towards the back of your throat into your brain. It does not actually go into the brain. We do get some questions about that, but it just goes to the very, very back of your nasopharyngeal cavity. And that's so that the virus can be picked up where it likely lives. Testing is then done. The swab is then sent to either the state health laboratory in Richmond or to commercial labs. And there are 2 commercial labs that are now doing coronavirus testing, both LabCorp and Quest. There are a couple of challenges to test availability that we have run into. First is a lack of materials to obtain and process specimens. So these swabs require a specific bath, basically, that they need to live in on their way to the lab, and that's called a viral transport medium. If you just leave them dry, then the virus will die on that surface and it won't be able to be detected in the lab. So they need to be kept on material that resembles what a human mucous membrane is. And so as viral transport medium are used in testing, there is less available for future testing. There may be a lack of appropriate personal protective equipment in medical offices or a perceived lack. CDC changes guidance periodically based on research that they have on how this virus is transmitted. And so the PPE requirements have shifted a little bit over the course of this pandemic. However, they haven't shifted significantly. But if medical providers do not have the required PPE in order to perform the test, then they may not decide to do the test. And there also is a high burden in emergency department settings. So as people present to hospitals around not just Fairfax, but around the country, there may be an increased burden on healthcare providers to perform testing, and at those locations, there may be a triage that occurs about who would be tested and who would be sent home with instructions for home care. So right now, we do have some priorities for testing here in Virginia. Severely ill patients, individuals who are at a high risk of severe disease, those who are in high-risk situations like long-term care facilities, and then essential service providers like healthcare and public safety. Those are the current public health priorities for testing. However, individuals who go to their private physician can order testing through one of the private labs, and that does not need approval from VDH or from the Fairfax County Health Department. This virus typically will present between 5 and 6 days in from the date of infection. It does not develop overnight. It has not developed overnight in the large majority of instances. In some cases, there is documentation that people may become ill on day 13 or 14, but that is not the norm. The norm is typically 5 to 6 days. Some individuals will require hospitalization. That is estimated at about 15% of cases, and about 2%, which is that case fatality rate I mentioned before, will die from the virus. Coronavirus is present in the nose and the throat at the highest levels around the time illness begins, so typically around that 5 to 6 day period. Individuals who are not displaying symptoms, research has shown, do not have as high of a viral load as those who are newly ill and newly symptomatic. So on that topic of asymptomatic transmission, there is a lot of material in the open domain about asymptomatic transmission and asymptomatic infection. It is not known how many people with COVID-19 do not develop any symptoms of illness. This is akin to somewhat of the dark side of the moon, where if you are not sick, then you are likely not going to the doctor to be tested, and therefore we don't have test results. We do have a couple of populations that were tested domestically where we had 100% test rate of a given population, a subset, and those were the cruise ship passengers who arrived in mid-February. And of those on the Diamond Princess cruise ship, about half of those who tested positive for COVID had no symptoms at the time of the test. And there are also some family clusters reported where someone who had no symptoms spread the infection to their family contacts. While this is somewhat concerning, this is not the primary way the virus spreads. Again, these coronaviruses are living, and so they are trying to survive just as humans are, and so they spread most effectively when we are coughing or sneezing. They are trying to spread themselves through that act. So if someone is not coughing or sneezing, then it's very, very hard for them to produce those respiratory droplets that lead to this infection. The other point to make is that this virus, unlike other cold and flu viruses, typically lives in the lower levels of our respiratory tract. And so you often hear about upper or lower respiratory tract diseases, and this is a lower respiratory tract disease. Another number in public health, and if you'll indulge for a minute on the public health number side and epidemiology, there is a number called the R naught, and it is R sub-zero. And this describes the number of people a given patient will infect if everyone is susceptible and there are no measures to control the spread of illness. And there are R naughts for every communicable disease that infect humans. So seasonal influenza and what we saw in the 2009 H1N1 pandemic, the R naught was about 1.6. So that means that for every case, that person got about 1.6 other people sick. COVID-19, we have a 2.6 R naught. And for measles, which is for public health an extremely concerning disease, it is 15. So we launch major public health investigations and containment measures for diseases like measles, because a single case of measles means we could have 15 other infections. Luckily, measles is a vaccine preventable disease, so that number is much lower in countries like the United States where MMR vaccine is relatively common. So this virus does track closer to the flu side, but it is not an influenza virus, so it's a little more contagious. I mentioned this before. Most illnesses are not severe. They do not require hospital care. About 2% of infected people have died of their illness. There is some research that suggests that number may be a little bit lower in the United States due to the quality of healthcare services here in the U.S. But across the globe, the highest risk of death is in the elderly and those with underlying disease. Public health measures are important with viruses that we have no countermeasures for. So when we do not have a vaccine and we do not have effective drug therapy, measures to stop disease spread include isolation and quarantine, which we have done in the United States, social distancing, which we are practicing now, and personal infection prevention, like hand washing and respiratory etiquette, which should be practiced at all times, are very important. With SARS, these measures led to the eradication of the infection. And with SARS, people with infection didn't spread the disease until several days after illness began. We do not have that luxury with COVID. COVID spreads from the moment people are symptomatic. So it is possible that people without symptoms can transmit. And we also have infection that has spread to many countries, and some countries do not have the same ability to implement public health measures as effectively as the United States does. So the bottom line is that the global spread of COVID-19 will continue, and it's up to public health and now everyone to implement measures to help slow the spread of the disease. So we work off of some planning assumptions in public health when it comes to public health emergencies. We plan that disease will continue to spread globally. We plan for community outbreaks that will occur in the United States. We expect that disease will occur in waves. Most likely, diseases tend to transmit most effectively during the spring and winter, but it is possible that we may have waves that occur over the summer. Up to 20% of the population may become infected. That is extrapolated from influenza pandemics, and that number changes the more we learn about how this virus spreads. But up to 2% of infected people will die, and we won't have vaccine and antiviral drugs immediately available, which we are seeing now. Those are in development, but those take months to come to market. So we do not have those in our back pocket, which is why we have gone to social distancing and some more basic containment measures. This is a graph showing the 1918 flu pandemic. You can see there were multiple waves that occurred over time. And then this was from 2009. You can see 3 different metro areas, Houston, Milwaukee, and New York State. And in each one, the peak looked different, but there were multiple peaks that occurred, and these are the waves that I was mentioning. So looking back or looking on the United States and what we are doing, we have a declared public health emergency. There is ample and constantly evolving guidance to health departments and to the public, as you are seeing. There's coordination of surveillance with state and local health departments. There is the diagnostic test that's being developed, and they are continuing to evolve and make those results turn around faster. There's expanding lab testing. Again, now it is in the commercial space, so there is substantial capability that did not exist when the lab tests were only being done at CDC. And CDC is deploying infectious disease teams to affected jurisdictions like Seattle, King County, and to New York City, where there is substantial spread. Vaccine trials are ongoing, and those, hopefully, we will have a vaccine within 12 to 18 months. That's usually the picture. And there is guidance for pandemic preparedness at large, which we are beginning to see implemented at the state and local level. Travelers from countries with COVID-19 transmission, it depends on the country individuals are returning from. U.S. citizens and exempt persons traveling from China and Iran are directed to one of 11 airports. Dulles is one of those airports. Once they arrive on the ground, they undergo a health assessment, and if they are symptomatic, they are transferred for medical evaluation. That is a process that CDC, the Virginia Department of Health, and the county work closely on, and that's something that we exercise on a regular basis. There's also contact information that is shared with the health department for follow-up, risk assessment, self-quarantine, and monitoring. For individuals returning from South Korea, Italy, Europe, the United Kingdom, and Ireland, there are CDC travel warnings, which I mentioned before. There is some screening at exit or on arrival. However, there is no public health monitoring conducted, so these travelers are told to stay at home and away from others for 14 days. Now we will go into containment and community mitigation, which you may have heard in the news, but these are two different strategies that public health uses to help slow the spread of disease. The first is containment, and so containment is our first line of defense. We implement this when we are fighting a new infection that humans have no natural immunity to. So first, we prevent the introduction of illness, prevent community spread, and eradicate infection. We do this by implementing travel restrictions, conducting individual case investigations, and performing isolation and quarantine. Individual case investigations I will touch on for a moment. We are still conducting individual case investigations, and we have, at this moment, over 200 health department staff who are working on making sure that we are able to contact each positive case and learn their whereabouts and their travel, both abroad if it applies and within the United States during the time that they were symptomatic. Isolation and quarantine is also an ongoing effort, and as we identify cases that need to remain at home, we facilitate that process to include provision of basic needs if needed. The other next step is mitigation, and mitigation takes place to control the spread of infection, but we do this after containment becomes ineffective or infeasible. So the goals here are to delay and slow the spread of infection in communities, reduce the peak, so you've heard the term flatten the curve, that's what we're talking about, and reduce community disruption to the extent possible by maintaining critical services. The strategies we have in our armory here, first is non-pharmaceutical interventions, which we'll talk about, continuity of operations plans, and vaccine and drug development. So if you had to put it on a graph, the red dot or the red arrow is what we would see. So we are somewhere between containment and mitigation. And in public health, we are often used to being in this kind of scenario where we're trying two different approaches at the same time, and that's what we're doing now. We are still following travelers returning from countries of concern. We are still doing individual case investigations, and we are still working with voluntary isolation and quarantine agreements. However, as you've seen, we have also started to implement some non-pharmaceutical interventions like social distancing, provision or curtailing of social gatherings, mass gatherings, closing of schools and things like that, to at least get ahead of the curve and try to mitigate the effects. So this is the flatten the curve graphic that I was mentioning. The pink or purple peak that is very high, it represents what would happen if there was no intervention, if public health said there's a pandemic, everyone for himself. We are not taking that approach in the United States, and we are very lucky for that. We are trying to flatten the curve, which is what that hatched diagram shows. So by implementing social distancing and other public health practices, we are trying to delay the outbreak. We are trying to reduce the number of cases that occur each day to allow patients to recover and free up hospital beds. And we are trying to reduce the total number of cases in the community to the extent possible. So we've talked about NPIs, and here they are in somewhat of a graphic form. At the personal level, which is your best line of defense, hand washing, covering coughs and sneezes, keeping from touching your eyes, nose, and mouth, which is very difficult. And we as humans are not very good at this, but we are hoping that people will heed the advice and try to keep their hands away from their eyes, nose, and mouth. Social distancing, that's the 6-foot rule. Voluntary home isolation and voluntary home quarantine for individuals who have the disease or are close contacts of someone who does. At the community level, you've seen a lot of this already. Social distancing, dismissing or closing of schools, modifying work practices, telework, things like that, canceling mass gatherings. And at the environmental level, frequent surface cleaning with an EPA-registered disinfectant will kill this virus and prevent it from spreading. I mentioned before the 6-foot rule, and there are some ways that we can implement it that don't require a complete shutdown of society. We can shop during off hours, or we can buy online, telework, limiting face-to-face meetings and conference calls if you do have to have them, perhaps spread yourselves out, rearranging school classrooms, again, since schools are closed, that issue is somewhat put to bed, and avoiding crowded places in general. You've seen governor's orders saying that any gathering over 10 people is considered a mass gathering and shouldn't take place, and that's because in those mass gatherings, it's very unlikely that you're able to stay 6 feet apart. These are some pictures that we've seen over the last couple of months. The one on the left comes from Europe, where they played soccer or football in an empty stadium. And then there is a picture of Times Square from a few days ago where it was barren and there was no one there. So those are positive signs. They are inconvenient for folks who are visiting and wanted to see the sites, but they are very positive from a public health standpoint because that means that people truly are social distancing and the risk of exposure is low. This is the governor's order on closing of or limiting of mass gatherings. The numeric limit is important, but it is the intent that we really go for on the public health side. So the point is that we want people to socially distance. If you have 20 people in a small room, it's very difficult to maintain 6 feet. If you have 5 people in that same size room, you may be able to distance yourself 6 feet or more. This also protects high-risk individuals from being tempted to go out, or for people who may not be severely impacted by the disease, they may still carry it back to a high-risk individual, and this prevents that from being a possibility. And then there's also the need for protective behaviors at all times, regardless of numbers. So just because you have 9 people in a building does not mean that we should not social distance and clean high-touch surfaces and things like that. This was the guidance that went out today, the governor's order that goes into effect tomorrow night. And we've already touched on that earlier tonight, but that is available on the Virginia website. So we'll talk a quick minute about workplace and business preparedness, because this is important that businesses are able to maintain to the extent possible their service lines during this pandemic. So the first thing is to enable non-pharmaceutical interventions to take place. So reviewing sick leave policies, making sure that they are supportive of good practices, encouraging hand washing and respiratory etiquette in the workplace, and making sure that employees stay home when they're sick. Enable social distancing in the office or in the workplace, looking at telework and flex time policies. If your business is one that can be conducted where you can do meetings virtually, that's preferred to in-person meetings. Supporting protective behaviors. So if you have tissues, making them available to all of your staff so that they can cover their coughs and then throw the tissue in the trash. Hand sanitizer with greater than 60% alcohol is a good substitute if you cannot wash your hands with soap and water. And then increasing environmental cleaning with an EPA-registered disinfectant. Continuity of operations is another term that you've heard in recent weeks. This is the idea that you have a plan in place to maintain your business during events like this. And so it's important to plan for the reality, which might be that you may have about 1 in 5 staff members who aren't able to work because they're either taking care of a family member who's sick or taking care of themselves, and that you plan for potential disruption of supply chains, which we've seen particularly on the toilet paper front. But the production and movement of goods is a national priority, and that's something that we have not seen subject to the restrictions placed by governors around the country. And then considering the needs of your entire workforce, so you have individuals who may be at a greater risk of contracting the disease, or those who may not have the same safety net, who may not be able to weather 2 or 3 weeks off from work in the same way as another employee. So what can businesses and organizations that stay open do? We talked about this a little bit already. Actively encourage people who are sick to stay at home. Separate those who are sick from those who are well. Ideally, you would be sending them home. Emphasize that people should stay home and don't even come in if they are sick. Perform routine environmental cleaning. Advise employees before they travel that they should take certain steps. And then every employer should consider how best to decrease the spread of respiratory illness, not just for COVID, but for influenza and other diseases year-round. There is a document from the Department of Labor, which is guidance on preparing workplaces for COVID-19. This is available as a link from the CDC website, but it talks about absenteeism, it talks about changes in commerce, and it talks about supply and delivery disruption. So we mentioned this. This is just a summary of the big key takeaways for businesses to reduce illness in the workplace. There are some graphics. You can see one on the right-hand side of the page that you can print and hang up in your workplace if you still have employees who are coming in who are not teleworking. And it covers in graphical format these same concepts of reducing physical contact, staying home when they're sick, teleworking when possible, cleaning, environmental surfaces, disinfectant, that kind of thing. Canceling of gatherings, this has been pretty much taken care of. There were, for a little while, discussion about whether trade shows and conferences would continue. For the most part, those have all ceased, at least for the next month or so. So non-essential work travel, especially non-essential travel to countries on a CDC travel health advisory country should be postponed or moved once this virus subsides. And then environmental cleaning, we've talked about that, regular disinfectant of all hard and frequently touched surfaces. And again, thinking about those in your workforce who may not have who may not look like you, and so we want to plan for everyone in our population, those with physical disabilities, those who English is not their primary language, those who may not have paid sick leave, and those who are economically disadvantaged. And for retail locations that are remaining open under the governor's order, trying to use online transactions wherever possible, booking or scheduling clients to stagger customer flow, and then following guidance about limiting attendance at larger gatherings, including managing people coming into your business, leaving your business, lines within the establishment, and people waiting at the entrance to enter. So just a quick note on what this looks like across the board. We know that in the Fairfax Health District, we have individuals who are at all levels of the socioeconomic ladder. And so we know that we have people who may be from disadvantaged communities that may live in more crowded settings. They're more likely to rely on crowded public transportation. They are less likely to have jobs where social distancing can be done. They are less likely to have paid sick leave. They're less likely to have easily accessible sources of medical care. And as a result, statistically, illness is more likely to occur and more serious consequences of infection are likely. And so that's something that we have been working on at the health department level with state and federal partners about how we can better provide for individuals across all spectrum of our population. This is a graph from 2017 showing the percentage of U.S. workers with paid sick leave. This is just to show that it varies by sector, and so we plan for all of the sectors in public health. This is another graph showing access to paid leave by race and ethnicity. This data comes from 2019, so it's very, very recent. And this shows access to paid sick leave on the left and access to paid leave for childcare on the right. So now we'll talk very quickly about what the county is doing. And again, the county in this sense is the Fairfax County Health Department, which is working as your health department here in the city. So we activated our incident management team on January 22nd. This virus, again, emerged in China for the first time in December. It was on our radar pretty much the first time there was a study published out of China for what was at the time an unknown pneumonia. We have been coordinating with federal, state, and local partners. We are monitoring travelers daily. We're conducting surveillance around the clock. We are consulting with providers in the community who may have individuals who have symptoms consistent with COVID. We are providing information to county partners and the community, and then we are preparing for mitigation activities to reduce the impact of a potential pandemic. We provide online guidance through our website. As I mentioned before, this situation changes often hour by hour. So we update guidance and we post it on our website. And you can go to that website and you can see a what's new banner, and that should direct you to things that may not have been there the last time you were there. We also have a text alert system, so you can subscribe to updates. You can check the city website. We are also operating a call center, so individuals can call in and have questions answered by a specialist from the health department. And we are trying to maintain a strong presence on social media and Nextdoor and other websites to get the message out as broadly as possible. We continue to do community engagement and education on non-pharmaceutical interventions. These are strategies that most members of our community were unaware of 6 months ago, 6 weeks ago. So it's been an uphill battle to do education, and that's something that we work on daily. We are also conducting outreach to vulnerable populations, businesses, places of worship, community organizations, outpatient healthcare facilities, and working with our regional partners, not only in public health, but in public safety, about how we can respond to this. So a couple of questions that we've been receiving. Number one, should I wear a face mask? CDC and VDH and the health department do not recommend that people who are well wear a face mask. The reason is that face masks should be used by individuals who are showing symptoms of any respiratory illness, including COVID, to help prevent the spread of disease to others. These masks, the simple face masks you see, are designed to contain droplets from someone who's coughing out, not necessarily to filter droplets coming in. The filtering of droplets coming in is what an N95 respirator, you may have heard N95 or N100. Those are respirators that should be reserved for people who are taking care of someone with COVID in close settings, and that's typically the inpatient healthcare setting, so inpatient ICUs and floors within a hospital. Healthcare workers, EMS providers, law enforcement have additional personal protective equipment for COVID-19 just because of the frequency with which they may interact with COVID-19 patients. We also have questions, we've gotten questions about how long does this survive on surfaces, and there is still a lot of research left to be done on this. Survival of the virus depends on the type of the surface and the environmental conditions. This virus can survive frozen for a long period of time, but when you change humidity and temperature, it does not react the same way. So the half-life is about 6 to 7 hours on stainless steel and plastic, but it may survive several days depending on, again, the humidity and the temperature in the room that it's in. The survival time does not necessarily imply infectiousness. So you can have a virus that is quote, survived on a surface, but cannot infect a human, and that's an important distinction when you read studies about survival time, that it's actually a pretty complex web that goes into whether or not it's infectious. And we won't get into that tonight for the sake of everyone's time, but that's just something that we like to note. So contact with infected surfaces is not thought to be the primary mode. I mentioned this before. If you have someone who coughed and then coughed into their hand and then immediately touched a doorknob and then you touched the doorknob right after, that's far more likely than someone who coughed and then touched the doorknob and then the next day you touched that same doorknob. This virus can be killed very easily using disinfectants that are on the EPA list, and that list is available on the CDC website, but it's typically commercially available cleaning products. Those that have bleach and some other compounds are on that list. So what can I do? It's not all doom and gloom. There are some everyday actions that you can take to help prevent the spread of disease, not of just coronavirus, but diseases in general. First up is getting your flu shot. We are at the very, very tail end of flu season, but it was an important marker before because to the extent we can limit respiratory virus circulating in the community, the easier it is to identify coronavirus. So if everyone gets a flu shot and everyone stays home when they're sick, it would be a lot easier to identify cases of COVID because they would be the only respiratory or some of the only respiratory viruses presenting. So we always recommend getting your flu shot. It shortens the duration of illness. It makes it more difficult for the virus to spread because it doesn't, if you have flu antivirals on board, you're not symptomatic for as long. So there are fewer days that you are able to infect another person. And then seeking credible sources of information. We have a lot of information on our website and our social media channels. The city has an equally robust website for you. VDH, the Virginia Department of Health, has a website, and CDC does as well. And this is just a summary of what we've talked about, but there are very, very simple ways that you can reduce the risk of spreading this disease and other diseases that we should all be practicing year-round, although I will be the first to admit that we are not always good at this and some things slip by the wayside. But with a virus like this, it's important that we do as much as we can. So avoiding close contact with sick people, avoid touching our face, eyes, nose, mouth, staying home when we're sick, covering our cough, cleaning and disinfecting frequently touched surfaces, and washing our hands with soap and water for more than 20 seconds, especially after going to the bathroom, before you're eating, and after blowing your nose or coughing or sneezing. As I mentioned, there is existing or pending guidance designed for a large number of populations within our country, individuals and businesses, all the way to universities, higher education, emergency medical services, law enforcement, long-term care. Every day we learn more about this virus, and every day we get better guidance. So it's important that you check periodically a trusted source of information to see what's new. This is a listing. If you're at a computer, you can click on these links or take a screenshot and check them later. But we have a number of different resources at the local, state, and federal level that you can check out, and you can, where possible, where it's offered, subscribe to updates. So these are, that is the end of my formal presentation, and I believe we're moving into Q&A. But we have resources available through our call center and through our email address if people have questions.
Thank you very much, Mr. Brody. We really appreciate that. I'm getting a lot of great feedback about your presentation already. Next, we had scheduled Marcus Simon to say a few words. Marcus Simon is the Virginia House of Delegates representative for the 53rd District, which covers City of Falls Church as well as parts of Fairfax County. Mr. Simon, thank you for being with us tonight. We are happy to have you here virtually. Thank you.
Well, I'm glad to be here. I hope that you guys can see me. I'm happy to join you. Happy to hear that presentation. I think it was an excellent job. I just want to say a couple of things, and then I know that there's a lot of questions, and we want to get to be able to hear people's questions. We've heard a lot already about the executive order that the governor announced today, limiting public gatherings, and going a little further than he had in the past on restaurants and places of entertainment. So closing entertainment spaces. Yep. I can speak up. Can you hear me okay? That's better? All right. So, like I said, we've heard a lot about the governor's executive order today. The increased emphasis on the lack of public gatherings over 10. Closing restaurant dining areas altogether so that you don't have people congregating outside the restaurant waiting to get into the dining room. We've also taken some steps to try and recognize the hardships that these social distancing measures are having on Virginia residents. So we've, for instance, they've extended the tax filing deadline. If you owe quarterly taxes, we've given you an automatic 30-day extension to pay, and your personal state income taxes will not be due until June 1st this year rather than May. I know a lot of people would like us to see that go into July, which is what the federal government's done. The problem with that is that takes us into a new fiscal year. And unlike the federal government, we at the state level cannot run deficits. We have to pay our bills each fiscal year, and so we have to have a balanced budget. So that limits some of our flexibility at the state level. Our courts have closed to all but emergency hearings. So a lot of people have been asking me, what about evictions? Are they on hold? As a practical matter, they are, because the courts are closed to what are called unlawful detainer actions. So there'll be no evictions taking place for the foreseeable future while the crisis is ongoing and people are displaced from their jobs. The DMVs are closed, and so you can only do your DMV services online. But the governor has directed the state police not to enforce vehicle inspections for 60 days and registration. So if you're driving on dead tags because you can't get to the DMV to renew your tags, you don't have to be worried about being pulled over by the state police. We've created, the governor's already begun working on creating flexibility to add bed space to hospitals. So in the event that the social distancing doesn't do as much as we need to, we can quickly ramp up hospital capacity. And that's just a few of a number of things the governor's been doing. I posted a link on my Facebook site to all the things that are going on with the governor's actions and executive orders. I do want folks to know the governor is paying very close attention to this crisis. He has daily press briefings, daily updates. This is Executive Order 53, which replaces Executive Order 52 from just the day before yesterday. So as circumstances warrant, the governor continues to revisit the steps that we're taking at the state level to make the social distancing workable, possible, and keep folks safe. That is the highest priority of the governor's administration and those of us that work at the state level. As for Superintendent Noonan's request for more funds, that's going to be a challenge for all of us at the state and local level. I think we'll work together to make sure that whatever federal stimulus package comes out doesn't forget the need to have lots of assistance and lots of flexibility for states and localities. Because, again, unlike the federal government, we can't print money, we can't run deficits, we can't borrow. So we're constrained, just like the city is at the state level, by the revenues that are coming in. We can't spend more than we take in. So we're going to work with you all at the city level and with folks at the county and our congressional delegation to make sure that whatever federal stimulus is enacted understands the importance and value of giving localities and states a great deal of aid directly so that we can use it and prioritize it where it needs to go. So with that, I'm like I said, most of the good stuff was already covered. I'm happy to have joined you all tonight, and I'm happy to answer any questions that anybody may email in that I can help with.
Thank you very much, Mr. Simon. We really appreciate you being with us tonight. We are going to start the Q&A portion of our evening, and as a reminder, we might not get to every question tonight. The communications team is going to try to respond to every email received tonight with either resources, answers to the question, or forwarding to, say, the schools if they can answer that. So thank you all for everyone who has jumped in with questions. I am going to try to organize the questions, and we'll start with the health department since we just had the presentation. Mr. Brody, there are 2 cases at the Kensington that have been announced, and the Kensington is an assisted living facility. We have a number of questions from our residents about this. They are worried about the residents. They are worried about the staff. Can you speak to the health department's response to the Kensington?
Absolutely. As you are aware through media reports, there are 2 confirmed cases of COVID with 2 residents who reside at the Kensington. The health department, upon learning of the possibility that there may be cases there, we deployed what is essentially a rapid response team made up of epidemiologists, public health nurses, data folks, and a laboratory specialist to the facility, and we began working in earnest with them on this particular response even before the lab results came back. It's worth noting that the Fairfax County Health Department, through our epidemiology unit, has engaged for the last couple of years in an effort to work with long-term care facilities around the health district on issues related to infection prevention and control. So the Kensington was able to implement everything that we had recommended within a very short period of time because of the ongoing relationship that we have. We still have a public health nurse deployed there every day, and that will continue for the foreseeable future to assist the facility with technical assistance related to public health matters, to assist in gathering information for the contact investigation, providing advice on infection control and prevention, and making sure that staff in the facility are fit tested to wear respirators to collect specimens. And that is something that enabled us to get these specimens to test in the first place.
Thank you very much. All right, our next question is something that I'm sure we'll all be wondering at some point. If we start to feel sick, what should be our very first step? What should we do?
Yes, it's an important question. It depends. In short, it depends on the nature of the symptoms. So, if the symptoms are very mild, then that is typically treated in home. Again, the large percentage of individuals with COVID will be able to self-care at home, and there's guidance on the CDC website about how to do that. But it largely consists of taking the same actions you would take for any other virus or illness that causes a fever and cough and things like that. So taking fever-reducing medication, treating the cough with over-the-counter medications. If you are having more severe symptoms, like it is very difficult to breathe or catch your breath, if it's persistent coughing or coughing up blood, then that is an instance where you would need to seek emergency medical treatment, either through 911 or through an emergency department. If you have something in between the two where it's not quite mild, but it's not quite needing an emergency department visit, then it's a good idea to call ahead to your healthcare provider, let them know what your symptoms are, and then you can work with them on the best way to get into the office to be tested. It's also important to note that for people who are ill, regardless of whether or not they have a test result confirming COVID, we recommend that they stay at home and they do not interact with anyone else outside of their household. And there are instructions on the CDC website and on our website about how to take care of someone in your home who is sick, because it is practical to do that. It is possible to do that with a few modifications to your normal routine. There have also been questions about, can I test myself at home, or is there a self-test kit available? This morning, the answer to that was not within the next week, although this afternoon or this evening, some recent guidance from FDA came out stating that there is potential for a home test kit to be made available within the week through private laboratories. The issue that I mentioned before still remains, however, that the viral transport media and some of the supplies necessary to conduct the test are somewhat limited. And so there will still be prioritization of testing at the private labs for those who are hospitalized over individuals who self-tested at home with mild symptoms.
And the self-test, so that is someone is going to collect their own sample and send it off. It's not that there is a dipstick or something that's going to give them an immediate result,
Correct.
right?
Correct. Yes, these are laboratory. Right now, these tests require RNA analysis in a laboratory, so they need to be run on a particular deck in a public health laboratory. So there's no rapid at-home test. It would be akin to a DNA swab that you send off and then you get the results in a few days.
Very good. Thank you. Our next question for Mr. Brody. If someone had COVID and recovered from it, would a test show that they had already been exposed? Or do tests only show positive when you actively have the virus?
That's a good question. It depends on what is being tested and the test that's being performed. So right now, the priority has been on laboratory specimens that are collected from both the nose and the back of the throat, and those are RNA, so that detects the presence of that virus in those respiratory secretions. What may come along in the future are tests of other bodily fluids, so things like serum, where you would draw blood and you would see whether or not the person had antibodies. That would be a way to determine if the person was infected at a prior time and mounted an immune response. But right now, the public health testing priority is on actively ill individuals, so I can't speak to when there might be some kind of a serum test or something else available to detect a prior infection that has completely recovered.
Okay, thank you. We have several questions in here about people who want to be outside in the parks, and people understand that they need to stay 6 feet from each other. So no pickup basketball games, no playing on playgrounds. This question is about walking a dog or having an outdoor cat. Should they worry about the animal when they come back into the house, possibly bringing the virus back in with them?
Sure. So as with any disease, there is a large portion of research time dedicated to humans, but also there is a portion of time dedicated to companion animals, so dogs and cats and other kind of pets that you may have at home. All of the research so far on this virus, the SARS-CoV-2 virus, which is the actual virus that causes coronavirus disease, suggests that there's no reason to think that pets are a source of infection. There are coronaviruses that live, that pass from dog to dog and from cat to cat. Those are feline coronaviruses for cats and canine coronaviruses for dogs, but those coronaviruses do not cross over to humans. So while your vet may talk to you about coronavirus infection in a pet, it is not this infection. And so there's no public health research that suggests that kind of transmission is possible.
Thank you. There are a lot of rumors going around about COVID-19. Today's rumor is courtesy of the New York Times that there might be a loss of smell or loss of taste when you are infected by COVID-19. Do you have any information on that?
I don't have any, public health doesn't have any information beyond what was in the New York Times. This is what we see with novel viruses that emerge, that typically patients who survive provide a firsthand account of how the course of illness was for them. And those accounts can vary pretty dramatically depending on how they were exposed and at what point they developed symptoms and what their medical history and underlying conditions are to begin with. That sense of or loss of smell and taste is something that has been reported with this, although it is not one of the major symptoms. It's not been described in literature where hundreds and hundreds of patients report the same thing. That isn't to say it doesn't happen. It's just it hasn't been documented fully in literature the same way that cough, shortness of breath, and fever have been. And the other piece to note is that those symptoms alone are not necessarily indicative of COVID. Those can occur with other illnesses, particularly bad colds and things like that, where you aren't able to taste or smell as well as you normally do, given those illnesses.
Thank you very much. All right, our next question. How safe is it to order takeout from local restaurants?
So provided you and the restaurant you are getting your meal from do not cough on each other, it's very safe. So many restaurants have adjusted their business models to offer orders to go, and that's something that public health supports because 45% of Virginians get their primary source of meals is from a restaurant, either eat-in or takeout. So it's important that we don't restrict and cause further downstream impacts by public health action. So it's completely fine to order takeout and pick it up. And CDC actually has done some research into this virus transmitting through food. And there's a very, very low risk of spread from food that is even shipped from affected areas. So another question that comes up is, should I not have Chinese food or should I not order things made in China? And this virus will not last on products that are shipped over multiple days in cargo holds and then on a hot tarmac somewhere or on the container ship. So food in general is not thought to be the way this virus spreads. This is not typical like a typical GI virus that is spread through food, and we do worry a lot about those kinds of things. But the same general precautions apply about hand washing, before and after touching doorknobs, practicing good hand hygiene in general, covering your cough, sending someone who's not symptomatic to the restaurant to get the food versus yourself going, that kind of thing, which is just an everyday disease prevention. But no, there's very low risk for takeout food.
Thank you. And you touched upon the next question, which is there are a lot of people ordering from Amazon right now, either essentials or boredom busters for the kids. Mm-hmm. Should they be concerned about the box, the items that are in the boxes? What should they do?
So that's a good question, and one that has come up because this virus did originate in China, and people are concerned about ordering things from all over through our global economy. And again, the research into this virus suggests that it is not a particularly hardy virus. So when you consider all of the time that a given item would spend in transit from an overseas location to the United States, it would likely spend a period of time sitting on a dock somewhere. Then it would either be loaded into a plane or a ship, and it would spend a period of time either at very high altitudes or transiting an ocean on a ship. And then it would again sit in a truck. It would drive across from port to a distribution facility. So by the time it actually reaches you, the virus, to the earlier point about survivability, all of the public health research suggests that there's no risk from that kind of shipment activity.
Okay, and for things like cardboard, how long would the virus typically last on cardboard? If someone had coughed directly onto the package,
Right.
how long would it be on there?
It's hard to answer without knowing, number one, how much they coughed, what type of, what the environmental conditions were with the cardboard. So if it was extremely humid, if it was not humid at all, if they put it in a freezer or did not. But the earlier point still stands about the survivability piece. It's thought to be hours to days on most surfaces. This virus, for whatever reason, does not like copper. It dies very easily on copper, but it does tend to survive on hard, non-porous surfaces like plastic. Cardboard falls somewhere in between. Fabric falls somewhere in between. But again, it needs to live. Ideally, it wants to live in mucous membrane, so it wants to live in a warm, wet place, and that's typically not what you see with cardboard or cloth or fabric.
Great, thank you very much. All right, I am looking for our next question. We've been covering a lot of ground here, which is wonderful. Okay, I think we are going to move on to the schools. And I am still trying to organize and look at the questions as they come in. So Dr. Noonan and Mr. Anderson, here are a few questions for you. Let's see now. Dr. Noonan, I think you addressed this in your comments, but if you wouldn't mind saying again, is the completion date of the new high school going to be impacted by this?
Yeah, thank you for asking that question, Susan. And I did try as best I could to share the three questions in my opening remarks. But right now, we are waiting for an update from Gilbane on their schedule. And as I stated in my opening comments, because of the shutdown of a number of states, including Virginia, Pennsylvania, New York, and Maryland, we may experience some supply chain issues specifically to some of the materials for the school itself. So I don't think it's unreasonable to think that there may be some impact to the high school, but to date, we've not learned what those impacts are going to be.
Thank you. And another question is about the fall. Parents are worried about IB classes in the fall, maybe IB testing in the fall, and I think you addressed that the testing will not take place. Is that correct?
That is correct. The IB has shared with us yesterday, actually, they shared with us yesterday, and it was announced this morning at 8 a.m. Greenwich Mean Time, that IB exams this year will not take place. So those students that have been taking courses that are associated with getting the diploma. So if you're a senior and you've been working on diploma courses and you're in that sequence, based on the rigor of the course and the instructional programming, that diploma will be awarded, and IB certificates will also be awarded.
Will the schools be working with Vhsl to possibly move the spring sports to the fall?
That's a really great question that I don't know the answer to because they're both outdoor field sports in the fall and the spring. There would be some overlap of field use issues that could be potential. But I have not heard anything to that effect yet from Vhsl. But I would be a strong advocate if there were a way. But again, knowing, for example, boys and girls lacrosse would both use the football field or the stadium field, which is used for football in the fall. So it would just be a matter of trying to find the right solutions. But if possible, we'd love to look at some sort of creative solution, but I can't make any promises.
Thank you for that. How will online instruction change moving forward? I apologize that I'm trying to interpret this question. It's a couple of paragraphs long. So moving forward, perhaps after spring break, is online instruction going to be enhanced to look different? Is there anything you can speak to about that?
I think it's a good question, and it's one that we as a staff are currently contemplating what that would look like. The reason that it potentially would change in some way after spring break is because we would look at some point in the not too distant future to begin moving away from continuity of instruction and moving into potentially new material. If that is the case, then through that new material, there would be some more direct instruction or some different ways of recording lessons and things like that. But again, we're still, we learned a half an hour or an hour before the governor was going to close schools that he was going to close schools for the rest of the year. So we are planning and we're thinking about it, and there is going to be more information coming. But right now, what I can say is this, and that is that it's very unlikely and not at all best practices for us to have a teacher in front of a camera for 6.5 hours during the day to hold classes like we would normally. There will be potentially some synchronous portions of instruction, but a lot of online instruction is asynchronous, meaning that the teacher is not present for that and instead would hold office hours. So we're going to look at some sort of blended learning model where there would be some synchronous learning and some asynchronous learning. But again, we're still early in the process, but early right now means, 2 days away. So we should know more probably in the next week or so.
Thank you. I have a couple of questions from parents who have students with disabilities and special needs. So how are you planning to address those special learning differences?
That's a great question. And when we put the materials together for those 20 days to continue that continuity of instruction, we did put those materials together with modifications for our special needs students and modifications for our ESOL students. As I indicated earlier, we will be given some flexibility from the Office of Special Education Programs at the federal level. The state is going to provide some further guidance on that in the coming days. But with respect to that's more around some of the paperwork sort of issues, making sure that we meet our timelines for IEPs and the like. But with respect to actual services for our special needs students, one of the things that I mentioned in my comments that maybe didn't come through loudly enough is that our amazing special ed folks are going to reach out to every single parent in the next week or two to talk about their particular student and how we can meet their needs. That's one of the beauties of being a small system and having really great staff is if you are a parent of a special needs student, you can expect a phone call, a personal contact from someone from FCCPS within the next couple of weeks. And we'll work with you and with your student to ensure that that continuity of instruction is as appropriate as it can be, considering the needs of each of our students.
Thank you. Our next question is from someone who is asking, what if the governor closing the schools, what if that was a very premature decision? What if somehow COVID-19 is cleared up before the end of the school year? What would be the school's response? And this might also be a question that Mr. Brody could address. End of school would have been in June. So what happens if COVID-19 gets cleared up? Could the schools reopen?
I'll defer to the health department here in just a second. But what I would say, in the unlikely scenario that we were able to reopen this year, and I think the reason that we were closed was because it is an unlikely scenario. But we would have to make some good decisions about timing, when the school year is scheduled to end, and the like. So if we can open school, we would love to open school. Let me just say that. This is disappointing for all of us. We really want to have our kids in our schools, and I know parents do as well. So if there were a way that we could come back and with Fidelity really put a good program together for some time, we'd like to do that. But again, I think it's a rather unlikely scenario, but I would defer to the health department for that.
Mr. Brody, do you have any thoughts on that?
I agree with Dr. Noonan. It's highly unlikely, and the important thing to remember is that when we are talking about this pandemic, a lot of people want to think of it as a switch where it's either on or it's off, and it's actually a lot more of a dial. So right now we are in the early stages, and while we are hoping to flatten our curve, it is still a curve. So all of the time we've spent over the last couple of weeks putting these restrictions in place to slow the spread, public health will likely, we will, it's not a question, we will endure a lot of the same discussions about how we dial back these restrictions. So it's not going to be like a switch where everyone leaves their house all at the exact same time overnight. There will likely still be, and this is modeling that CDC has done for other pandemics, there will be a period of time where we may be asking individuals in certain high-risk groups not to leave their home for a little bit longer as we learn more about mortality and course of illness. So to Dr. Noonan's point, I don't really see, and VDH doesn't really see this kind of ending rapidly with kind of overnight. It's going to be a gradual return to normalcy.
If I can just say one more thing that was mentioned today during the governor's press conference, and that was that there may come a time during this outbreak where the schools are going to be asked to serve students of essential personnel. So, for example, if you are a medical professional or a first responder, there may be a need for our school buildings to be opened for those students so that the medical specialists and doctors and first responders are able to go to work. So in that same vein, one of the things that we will be planning for, and we don't, again, exactly know what the infrastructure is going to be for that, but we are also planning how we may be repurposing our buildings during this time.
Thank you very much, both of you. We appreciate it. All right, we are going to switch gears to Wyatt Shields, our city manager. We have a few questions about government services. Mr. Shields, can you speak to the farmers market, tennis courts, skate park? Do we have an updated status on if the farmers market will happen on Saturdays and if tennis courts, skate parks, anything like that are going to close?
Wyatt, do you want to unmute?
Thank you, Dr. Noonan, for helping me unmute my Skype connection. So I'll take those in turn, starting with the farmers market, and I'll just state the general policy of what we're trying to do is to limit public gatherings, and to the extent that there are city events or amenities that are attractive to larger gatherings, then we're trying to prevent that and close those. The farmers market is a special case because the farmers market is part of the city's food system. We did close it this week, really out of the interest of limiting public gatherings. We are working with our colleagues at the state to see if there's further guidance on farmers markets, and so we will make a decision based on what we think is best for the community, but also with state guidance on that issue this week with respect to this Saturday's market and going forward. I think it is likely that they will remain closed. Tennis courts, for two people to play tennis across the net from each other, that has not risen to a concern about a public gathering, and so those have not been closed. Our playground equipment has been closed because of the sort of the density of playing on that equipment and the risk of transmission there. Our playing fields, we're looking at those. This weekend we did have instances where we had large groups of people getting together to play sports. And we are considering closing our playing fields to the best extent possible. We'd like to keep our parks open. Being outdoors is healthy and a good place for people to be. What we're just trying to avoid is sort of dense congregations of people that could accelerate the spread of disease. That's really what the public policy goal is.
Thank you, Mr. Shields. Another question for you is, City Hall is still open to the public with some limited services. What is being done in City Hall to make sure that visitors and also staff are safe and able to practice social distancing and have clean surfaces?
Well, a couple things. One, we are, the City Hall is well posted with signs to encourage people to maintain distance. All of our counters, when we exchange papers and things like that, we are trying to do so by maintaining at least 6 feet of distancing per the health department's guidelines. For the public that does access City Hall, we have a route that goes directly to the 3 business counters, the permits counter, the Commissioner of Revenue, and the Treasurer. And no other aspects of City Hall are open to the public at the present time. City staff also are practicing social distancing at work, and our janitorial staff is doing regular intensive cleaning of City Hall, and particularly at those high-touch areas and the counters that are currently open to the public.
Thank you very much. And the last question I have for you is, how are you and council and other staff starting to talk about the loss of revenue that all of our businesses are going to feel, that the city's budget is going to feel? What are you doing to keep an eye on that and address it?
Well, it really does. Our business community is experiencing a lot of pain right now with all of the closures. It's an incredibly difficult time for our business community. That does translate, obviously, into a loss of revenue for the city government, and we're just now getting our hands around that. Karen Bawa is the city's chief financial officer, and she is working with regional colleagues to try to do the best forecasting we can in this environment. Stephen Fuller at the Fuller Institute has also provided their forecast for the regional economy, but those forecasts are probably going to keep changing as more information comes to bear. And again, we do have to plan for this to be a long duration event, and we have to take the health department's kind of worst case scenarios for our planning guidelines, and then hopefully it'll be better than that. But I think we need to plan for a prolonged reduction in business activity. So I think the 30-day pause is designed to help us get our hands around that, and we'll share information out with the public as soon as we have some confidence that our forecasts are going to be reliable.
Thank you for that. I have one more question for Dr. Noonan. This one just came in. There's a parent asking about graduation. Are you making plans to celebrate the graduates in some way?
This is a great question. We actually had a team meeting this morning about graduation. And at this point in time, we're not anticipating holding the graduation in the way that we were anticipating that we were going to hold it. However, I have asked our principal, Matt Hills, along with Mr. Bates, and then working alongside a core group of students, starting with Niharika Singh V, who is our student representative on the school board, to talk about what would a good celebration look like for our students. It's such an important rite of passage to graduate from high school, and we want to make sure that we do something for our students. Again, we just found out today that we're closing for the rest of the year, so we are putting a plan together with students in mind and with students involved. It is our intention to do something special for our seniors before they leave the City of Falls Church schools.
Thank you for that. I am going to wrap up questions there. There are a number that we did not answer tonight, and I want to let those folks know that we will try to get you answers or get you resources. Before we have Council Member David Snyder would like to get up and say a few remarks, and then we'll have Mayor Tarter close our town hall. And as Mr. Snyder is making his way to the podium, I would like to let everyone know that this is being recorded, and we will air it on our cable channels. That's FCC TV, Cox Channel 11, RCN Channel 2, and Verizon 35. We will also add this to our city website. We will also add this to our YouTube account. We will make this widely available. The PowerPoint presentation from the Health Department will not be available on its own. However, you can watch the video and see the PowerPoint presentation in there. And just a few quick resources on your screen right now. You'll see all the resources from Fairfax Health. They are very responsive via email and their phone, 703-267-3511. They are open Monday through Friday, 9:30 a.m. to 9 p.m., Saturday and Sunday as well from 9 a.m. to 5 p.m., and they have a wealth of information on their website. The city also has a number of resources on our website, which the mayor referred to in his opening remarks, and that is www.fallschurchva.gov. We have opened up a public information line. We are using employees who otherwise have reduced workloads at the moment, and that number is 703-248-5200, and that is being answered Monday through Friday, 9:30 a.m. to 5 p.m., and we would love for everyone to please sign up for Falls Church Alerts. This is our Everbridge system. If you read this current edition of the Falls Church News Press, you saw the owner of Everbridge let everyone know the importance of wide alerts being available. If we need to reach you for a large-scale emergency, this is the system that we are going to use. We will, of course, put on all of our other tools, Facebook, Twitter, website, but this is a great way to reach people instantly. You can choose to sign up through text message, emails, phone calls, any combination of that. So please sign up at alert.fallschurchva.gov. And lastly, we do have our daily update newsletter, and I am very happy that since we started this newsletter on Wednesday, we have over 400 new subscribers to the newsletter. So this is being received very well. We try to make it relevant. We try to make it quick because we know that in this time of crisis, you maybe can't process a lot of information, so we want to keep it simple and easy for you to understand. You can sign up for this at fallschurchva.gov/subscribe now. And we have all of these links on our homepage. Please do visit our homepage, and you'll see a number of categories, including our dining guide, which also includes information about our grocery stores, several which have implemented shopping hours for our senior citizens. So please do check that out. All right, Mr. Snyder, would you... Dr. Noonan, did you have something to add?
Remind people that the Falls Church City Schools also has a really great website and has all the materials for the online learning resources there as well, and a Q&A that we're continuing to build.
Thank you, Dr. Noonan. I appreciate you saying that. All right, Mr. Snyder.
Good evening. Last week, at roughly this time, the Falls Church City Council, your City Council, unanimously voted to approve an emergency declaration. That was done with a great deal of consideration and a full recognition of the importance of that action. As a maker of that motion and the longest-serving member of City Council, I felt it incumbent upon me to make a few remarks to the community. Since I first began serving in 1994, this community has prevailed in the face of the 9/11 terrorist attacks, the financial crisis, and multiple natural disasters. Each came on suddenly, each was of an unknown duration, and in each case this community rose to the occasion, as we are convinced it will now. You've heard from the best school officials that exist anywhere in the world. You've heard from the best city officials that exist anywhere in the world. You've not heard from our business community tonight, but I will say that they're the finest business community in the world. They're doing everything they can, consistent with the guidance they've received, to maintain their businesses to continue to serve our community, and it is in my hope that all of our citizens will support those businesses. As the city manager mentioned a minute ago, there will be a significant impact on tax revenue to our community. That is absolutely unavoidable. And just as that will happen, I'm convinced that we will need to adjust our expectations to adjust to the change just as that revenue has changed. In conclusion, your city council is working 24/7 on your behalf. Not only did we take that action last week, but we have communicated to the extent that we can, one-on-one and as appropriate under Virginia law, to help to continue to provide overall guidance to this city and to serve our community. That will continue, just as we'll continue our engagement through virtual meetings in critical regional transportation and other bodies throughout this area. So let me conclude by saying this. In far darker days than these in 1942, Prime Minister Winston Churchill said, quote, "Now this is not the end. It is not even the beginning of the end, but it is perhaps the end of the beginning." To my community, thank you. It is an honor for all of us to continue to serve you. We are very much all in this together, and just as we have in the past, we will prevail now.
Thank you, Councilmember Snyder. Mayor Tarter.
Sure. First, I want to thank everyone who's participated this evening. I think this has been a very informative and useful presentation to our public. To our public, I would say we have a commitment to you to continue to communicate in this fashion and through daily updates and through other means to make sure you get the most current information possible. And I want to just conclude by just asking everyone to please follow the mandates and recommendations of our public health care professionals. Thank you very much.
Thank you, everybody. Mr. Shields, Mr. Simon, Mr. Anderson, Dr. Noonan, thank you all for joining us. We really appreciate it. Again, this video will be made available widely, so please look for it in our daily updates tomorrow, and please subscribe. This concludes our virtual town hall. Thank you.